we are gonna present Segmentary Occupational Safety and Health BE12202. So for the introduction, according to OSHA, health hazard refers to a chemical which are classified according to its potential to cause someone to have the hazardous effects. So it is generally indicated by the occurrence of signs and symptoms in the exposed being. It occurs commonly in non-occupational exposed population and also defined as a long-term risk since the affected person could develop cancer or severe illness. It could be separate into three hazards, which is chemical hazard, biological hazard, and psychosocial hazards. So there are three main objectives that we need to study. We need to identify and study, which is to study the cause of health hazard in industrial sectors, to analyze and come up with recommendations to prevent health hazards, and also to refer OSHA guidelines on how to manage health hazard risk.
For the background of incident, company background. First, the company involved in this accident is manufacturing industry, manufacturing factory in Kulim High Tech Park, KHTP. KHTP was the first high tech industry park in Malaysia, and then it located in Kulim, Kedah. So for the background of incident, chronology of case. First, the leaking of ammonia gas, then reported at about 11:40 p.m. night, according to the Kedah Fire Rescue Department, and then happened on 2 of February on a Sunday night, and then the firemen arrived at the place, discovering the leaking ammonia gas in a storeroom. 49 employees that were affected with the leaking, as they are seen vomiting, and among them 10 employees were critical and were admitted to the hospital. Then ambulance that were deployed to attend to those affected by the dangerous gas.
Okay, for the discussion, the main cause of the employees affected by ammonia gas is the leakage of ammonia gas in the manufacturing factory. Okay, for the first one, as stated in the article, it was reported to the Kedah Fire Department that there was ammonia gas leakage, and the leakage started at a storeroom where the pipes of ammonia gas supply for the production is located. Okay, we want to discuss the effects of ammonia exposure. There are three types of exposure of ammonia. The first one is inhalation. Okay, what is the effects of the inhalation exposure? The first one is irritating and corrosive to the nose, throat, and also respiratory tract. It is also will cause respiratory distress and or failure of respiratory system of a human. And the last one is coughing and vomiting. The second one is exposure to skin or eye contact. The effects are skin or eye irritation effects, severe injury or burn the skin, permanent eye damage or blindness, and frostbite injury. For the last one, the third exposure is ingestion, which is when ammonia gas is put into our body by mouth or anything, and the effects is corrosive damage to mouth, throat, and stomach. In this particular case that we have chosen, most of the victims were exposed to the inhalation type of ammonia gas exposure. This is because of the gas leakage from the pipe. Early steps to prevent the health issues. Okay, for the first one is evacuate from the leakage area. Description is, if the release of ammonia gas is outdoor, then please stay indoor, or if the ammonia gas is indoor, please evacuate as far as possible from the contaminated area. And this is to prevent further exposure to the gas. The second one is remove any clothes that may have contact with ammonia gas. So how to do it? Put the clothing in a sealed bag or plastic bag. Don't hold the plastic bag. and dispose the clothes while following proper protocols. Store the bag away from people because this is to ensure that there are no further contact of ammonia with the body. The third one is wash it with plenty of soap and water. Remove any contact lens or glasses. Wash glasses with soap and water. Don't use any bleach to wash out the ammonia. Extra step, we can also shower to get rid of the ammonia. And the last one is seek medical helps. Call the professionals such as fire department and ambulance to help with the leakage.
Recommendation, there are several recommendations that can be considered by the manufacturing factory to prevent or reduce the effects and risk of ammonia accident. Okay, for the first one is a monthly ammonia pipe assessment. Okay, to maintain good condition of ammonia gas pipes to identify and malfunction or risk of ammonia leakage. The second one is provide showering place near the place that have ammonia gas to make it easier for employees to clean themselves when exposed to ammonia. And the third is placing ammonia pipelines further from the public places. Placing ammonia pipelines from places that are accessible easily by employees, and increase security at the place that have ammonia. Thank you.
So in conclusion, first we learned that the effects of ammonia in any shape or form is very dangerous if it is exposed to people. Second, in this particular ammonia gas leakage, it has affected the health 49 employers to the point where 10 of them had to be admitted to the local hospital. Third, we also found the steps or guides in case there was ammonia exposure. Incidents happen that the steps mentioned in the report is the early treatment that can be used by people who are suspected of exposure to ammonia substance. Fourth, last but not least, we have listed out some recommendations for manufacturing factories so they can provide the means to help ensure ammonia exposure can be prevented and lowering the risk of effects. Thank you.